Real quick, I'd asked the question earlier when Dr. Hellerstadt was here about the idea that fits in with what you've talked about, is that when we test someone, rather than just say, give them, yep, you're positive, you're negative, be on your way, that we at least provide them information of what we know out there can be used, not trying to play the role of doctor out there. Do you agree with Dr. Hellerstadt's interpretation that that should not be done because it's setting up a doctor-patient relationship and simply informing people or providing with over-the-counter drugs that so that we could possibly have the early treatment for these folks rather than wait till they show up in the hospital?
We could at least have a physician group approved a guide. The AAPS guide has been used in over 500,000 cases in the United States. In fact, the early treatment is probably what prevented us from overflowing the hospitals in the last quarter of the year. When I testified, I said, listen, we're on track, and I was very convinced of this, we're on track of overflowing our hospitals. Our break point was 135,000 in the hospitals in the United States. We hit 128. Now, the curve started going down long before the vaccine. So I can tell you, herd immunity, long before the vaccine showed up, started to go down. But the early treatment kicked up. Ivermectin use skyrocketed. Hydroxychloroquine, monoclonal antibodies, as much as we can push them. Sadly, the monoclonal antibodies are still sitting on the shelf in a lot of places. But committees like this ought to be saying, listen, where are those monoclonal antibodies? Do we stock them at the nursing home? What are the big nursing home chains? What are the big urgent care chains in Texas? And what are they doing? What are their early treatment protocols? You know, these are blank spots. I bet nobody here has even thought about this. This is really low-hanging fruit that we can tackle. The bottom line is a lot of doctors have checked out, and when patients call them, they say, I don't treat COVID. And when I asked those doctors, I said, you don't treat COVID? How come? They go, well, there's no treatment. I said, but do you call them 2 days later to see how they're doing? No. So what's that? That's not I don't treat COVID. That's I don't care anymore. That's a loss of compassion. So we have a crisis of compassion in our country in the medical field. That's in our house right now. But for every doctor that's ever told a patient that they don't treat COVID, okay, but then they call them 2 days later and help them get oxygen or see how they're doing? If the answer is no, that's the Hippocratic oath going out. And that's on us. And I'm telling you, we have a real self-check to do in the House of Medicine.